So, good morning and welcome to our fourth annual Iowa Workforce Health Symposium. I am Wesley Franklin, the Community Impact Director for the American Heart Association. I want to thank you all for joining us here today. We have an exciting agenda spread over 2 days for our virtual symposium. So today, you will have the opportunity to learn from some amazing leaders within the health and wellness industry. So let's get started. Our theme today is Wellness Reset. This isn't a new topic for us. We've been focused on employee health for a long time. We know that people spend a lot of waking hours at work. So we have an opportunity and responsibility to impact the health of our communities by creating healthier work environments. But a reset is important, not only because it is the new year, a time to reflect and make changes, but our workplaces do not look the same as they did 2 years ago. Many companies have made permanent changes in the way employees work since the start of the pandemic. So our work to create a healthier workforce needs to change as well. By coming together today, we can share some ideas, some key learnings, and resources to adapt a work for the best possible outcomes. We have more than 50 employers from across Iowa represented here today. Some of you have 10,000 employees, while others have 10. Regardless of the size or industry of your organization, we know that our employees need environments that promote health. When our workplaces are set to encourage and reward healthier behaviors, we all win. As we shape our work in the new workplace, we want to ensure that we are reaching all employees, regardless of race, ethnicity, gender, religion, sexual orientation, and educational level. Our hope today is to connect you with tools and resources from the American Heart Association, but also give you the opportunity to explore emerging trends in the workforce from our industry experts. So now we would like to take a moment to recognize our generous sponsors and key contributors who made this day possible. Our presenting sponsors here today are Des Moines University, Grinnell Mutual Reinsurance, Shazam, Healthy Estate Initiative, and the Iowa Department of Public Health. Thank you to these supporters listed here on the screen. Be sure to visit our event page to look at their provided resources to support today's topic after the workshop. We'll have a representative here from the AHA to be dropping in those direct links to those resources in the chat box to share those materials. So now I would like to take this time to introduce our keynote speaker to help set the tone for today's conference. And Ryan Piguerella has worked with communities and organizations around the world to ignite social movements while improving the lives of all people. Widely known for his thought leadership, Ryan has worked with Fortune 500 companies, been a keynote speaker at global conferences, and currently serves as Executive Vice President, Growth and Partnership at Life Guides, and as a Senior Fellow with We in the Nation, focused on well-being and equity around the world. Ryan earned a Master of Science in Industrial and Organizational Psychology from the University of Tennessee at Chattanooga, go Mocs, and a Bachelor of Science in Psychology from Northern Arizona University. So please help me welcome my dear friend, Ryan.
Thank you, Wesley. It's so nice to be here, and I appreciate the American Heart Association and all of our sponsors and all of you for giving us some of your time today. I really am excited to be here, and we're so close to meeting in person, but hopefully next year, and certainly appreciate taking the safe route with this. I think it's all becoming kind of the new norm and just rolling with the punches. So thank you for the quick pivot and making this a virtual event, and look forward to our time together. So as we get started, I know it's, maybe take just a big deep breath, because I think it kind of just helps center. I'm going to cover a lot of information today. We live in arguably one of the most exciting times and most challenging in human history. So if you think about, we've got billionaires now that are taking joyrides to space. There are technological advances that are happening that we've never seen at this pace before. All of that has a massive impact on our organizations, on our communities, on our own health and wellness, on our own behaviors, on our children. All of this is changing at an epic scale. And so I want to go through how some of those changes can impact us personally and how we can maybe think about how to incorporate some changes within our organization. Prior to joining Life Guides, I was the CEO of the Wellness Council of America and had the opportunity to come to Des Moines a couple of years ago and meet some of you all. So it's really nice to be back, and I appreciate the invitation. And just a couple titles up there. And I think my goal here is that our worlds, where there might have been lines between work and personal, is all kind of one big soup, right? So I have my corporate title. My kids could come through that door. You might hear my dogs barking. My neighbors could stop by. I'm a cousin, and my most important title, and I know Wesley can appreciate this, is daddy. And that's also been interesting. I think we've all been, locked in our homes more than ever. And so hopefully we've taken some of that opportunity to reconnect with our family and with ourselves and really recognize what's really important in all of our life. So again, thank you all for having me. I was in wellness for a long time. Prior to Wacoa, I spent a lot of years at a Blue Cross plan, working with a lot of their book of business and really trying to understand how can organizations really help improve the health and well-being of their employees. I think on the surface, right, that seems like it is the right thing to do. I think organizations should have a vested responsibility in doing everything they can to help their employees thrive. The reality is we spend most of our time at work, well, at least working. Now, it used to be at work in the building of work. Now it's working probably in our home offices. But something really hit me hard at the beginning of the pandemic last year. And I was talking to a nurse friend of mine. This was in March of 2020. So this is when things were starting to get out of control. And I asked her, I said, how are you doing? And I said, and I'm curious, how is your wellness program supporting you right now? And she said, quite honestly, she said, our wellness program consists of me and other nurses going into closets, holding each other and crying. And I said, that's absolutely heartbreaking, because taking 10,000 steps, drinking more water, that wasn't part of their program at that point. And the support that they needed, really from a mental health perspective, they weren't getting. And even before the pandemic, you all probably know the top trend for organizations to focus on in terms of programming was mental health support. And of course, the pandemic hit, and that need became even more so than ever before. The people on the front lines, we are all, I would say, all essential workers. Everybody is trying to survive the best that they can. And certainly those that are facing patients really have had a hard time. And it never seems to, we never seem to get an end, right? When we start seeing some light at the end of the tunnel, it seems like there's a new variant, a new cancellation, and we're locked back in our homes again. And so I challenge all of you as we're going through this presentation, how are we really supporting our employees in a very different way? How do we help the Nicoles, the nurses, and everybody that has to show up, regardless of what their job is, be their best self, recognizing that their world, their reality behind their computer is very different than all of ours. And their experience and what they're going through is different than all of ours. Next slide, please. So for me, it was kind of a time for a personal reset for myself. And so I was going through some major life challenges myself. I had a sister that had terminal cancer that lived away. There's my two daughters, that's Ellie and Luca. They just turned 5 at that picture. Their school was canceled. And so I needed to take some time for myself. So what I did is I bought a little camper there. And that was our world for about 8 months. I left Wacoa in June of 2020. Prior to leaving, I did discover the company that I'm with now called Life Guides. And was really blown away, but I needed some time. I wanted some time to take care of my sister and to be with my girls. In the first part of my career, I felt like I was traveling a lot and I wasn't balanced, and I needed to sort of get back, reground myself and really reconnect with my family. And so that was my goal. So from June of 2020, and I know I'm in Omaha, for those of you who don't know where I'm at. And so, obviously from like November through March, camping season is not a reality. So I said, you know what, when it starts getting cold and I winterize the camper, it'll be time to really start thinking about what I wanted to do. But what I wanted to do was really turn the wellness industry a little bit upside down. And I started a business called Conscious Disruption. And the idea is, how do we intentionally, very consciously start changing policies and process and the way that we treat people within organizations to really optimize health and well-being? And I'll tell you, my 2 greatest teachers, you're looking at them. I never would have thought that all the lessons that I needed to learn, all the knowledge that was there, was really right there, and seeing the eyes through 2 5-year-olds. And really what mattered in the world, what matters to people, is that sort of that authentic, that childhood love, discovering the world, nature, and love for the first time. And how do we sort of bring that energy back to the work that we do? And so that became, my passion. I ended up joining Life Guides actually in 2021 in trying to bring more love, hope, support into the world is the work that I do now. So that was, and I was fortunate enough to do that, but being outside, being in nature, and being with 2 5-year-olds was the medicine I needed to get me back going again. Next slide, please. So as Wesley mentioned, we've got a new world that we live in, right? I mean, things are never going to go back to the way that they were. And I think that we all sort of acknowledge that now. And so the big question is what are the opportunities that have been created, and how do we, adjust and pivot and be flexible? And, we've heard unprecedented over and over, and it is unprecedented. And these are new times, and these are new challenges, and there are new opportunities that come with that. The challenge is that our lives are, definitely more complex than they have been in the past. I think we realize that virtual and teleservices are here to stay. They're not going anywhere. That whether that's, patient care, whether that's customer care, whether that's working, that all of us we've gotten very comfortable operating behind a computer, and that's not going away. The also reality is that working from home has created less connection and a sense of well-being. I'll tell you, when I took, the 8 months or so in my camper and I got back, I could actually see people's faces change a little bit, and they were really struggling. It almost reminded me of not seeing a child in a year or two and then looking at them and saying, wow, you grew up so fast. And it was like, wow, you can really see people struggling, trying to navigate this, being locked in their homes. Just imagine if you had someone that was in a toxic household and you couldn't leave it, where work maybe was a place of refuge and now you couldn't go anywhere. So this really did create new challenges, and not to mention that we weren't able to connect with family, whether it be for holidays or just down the street, or having that connection that we did with our neighbors, our family, our work colleagues. All of that was gone. And that really has taken an incredible and immense toll on all of us, all of our families, and all those that we work with. The other reality is that underserved populations are harder to address than ever, where we had gaps between socioeconomic areas, we had equity gaps between our communities, our organizations. It's now even more challenging, not to mention that the political divide that's happened for the last, couple of years has really put a rift through all of us. These are challenging times. And when you can't connect, and I think people, when they get behind a computer, whether it's through social media and others, they behave in a very different way than they would when we're actually have that opportunity to connect in human to human fashion. And the thing that businesses are going to challenge with is that employees have a whole new, sort of radically new and expanded expectations of their employer than ever before. I've told the CEO of Life Guides many times, and honestly, I'm glad I'm not a CEO right now. I can't imagine trying to lead a company through this, not just from an organizational perspective, but even trying to connect with employees. The days of walking around with a cup of coffee and saying good morning to everybody and checking in, having that sort of real connection with people aren't here anymore. So how do you make sure that your people are okay? How do you make sure that people aren't struggling behind a computer? And how do you continue to build culture within an organization when it's all behind a camera and a computer? That's a challenge. It can be done, but it's certainly a challenge. Next slide, please. So before we kind of dive into some of the how-tos, I wanted to just start with some of these new world megatrends. As I mentioned at the beginning, we truly are living in one of the most exciting times of human history. There are things happening that I couldn't have even dreamed about 20 years ago. And so that, again, it presents challenges and opportunities. The first piece of this, the human connection piece. With that, there are certainly some things that organizations and communities are dealing with. Death by suicide has risen. Mental health, issues have risen. Substance abuse is a challenge. The human connection is something that we as people all desperately need. It really is part of our health and our well-being. And when that goes away, sometimes we can look for other things to fill gaps that don't have that. And so as we're thinking through how do we really take sort of our organizations and ourselves into the next level, focusing on building those connections. And there's some simple steps that we're going to talk about how we can do that, both in terms of organizations, but in our own personal lives, because it starts with us, right? We can't take care of others if we really don't take care of ourselves first. And that's a big issue for every caregiver. And HR is a caregiver to the organization. And HR, just like any nurse or doctor, is trying to take care of their people the best that they can. But it really is important that we really take some steps to make sure that we're doing everything we can. Therefore, we can take care of everybody that we're trying to take care of first. And so it's created a sort of very different dynamic than what's happened before. Other types of human connection things that, we're starting to hear more about, I'm not going to really talk about today. Everything from aging parents, even psychedelics are kind of an interesting, for healing. There's sort of all these alternative treatments that are coming up that really are focusing on how do we enhance connection? How do we help improve substance abuse, decrease post-traumatic stress, whether through service workers or others, to really enhance, sort of that grounding and connection with people. Technological modernization. This is a huge one. And, again, I could spend, the next 2 days talking about some of these things. I'm sure many of you have maybe heard of the metaverse, and that might be a scary thing right now, whether it's virtual reality, augmented reality, metaverse, all of these things are crazy. I mean, for us to think about how they work, but I will tell you that they can also be very exciting times as well. So if you think about, the metaverse, maybe, an applicable situation that would be kind of exciting if you could put on goggles and you would virtually be in a room with your colleagues. You would virtually be at the conference as if we were all there in Des Moines together today. That's an interesting thing. And again, this is, budding technology that's really going to impact training, that's going to impact the employee experience. You can create sort of an artificial world through some of this technology. And again, as we begin to train, take care of, support, provide care, whether it's through, provider, through counseling, through mental behavioral health, all of these things are going to have some very real and interesting sort of technological implications to all of that. That's really going to change really the future of work and the future of our employee experience, which is a huge part of that as well. Things like cybersecurity. I mean, all of our data, you think about everything that's being, tracked online. There's some interesting movies out there that The Social Dilemma and others that talk about how we're taking this information, how organizations are using that information, how far should we go with that information? Again, some huge, interesting kind of ethical questions that all of us, all of our organizations are beginning to have to ask each other. Whereas biometric screening and health risk assessments, and there were some major trust issues associated with that. Well, think now what our organizations are going to know about the employees, especially if everything is done virtual. Kind of a funny story. Whenever I have a new background behind me, it's kind of funny. Everybody on my team says, where are you now? Where are you now? So, even people are starting to recognize, whether I'm in my house or a coffee shop or a friend's house, our privacy in our homes is changing. And I think these are big questions that, as organizations, do we have backgrounds on us so no one really knows? And again, huge questions and technological implications that, all organizations are going to have to be thinking about because it's changing our world. And like I said earlier, not to mention, we've got billionaires flying around on spaceships, taking joy rides to, the edge of the solar system. Also fascinating. And pretty soon we're going to start seeing tourists, probably what we already have in some capacity. So that's also kind of interesting. Quantum computing, another huge one. I mean, basically taking computers and, putting them on, steroids, essentially, where the technology in this computing is fascinating. The last one I'm starting to hear more about is just this whole kind of artificial intelligence. The thing about artificial intelligence is we have the technology, but artificial intelligence requires data for it to be relevant. And again, all organizations are going to have some element of artificial intelligence. We're already seeing it with various apps. We're seeing it in wellness apps. We're seeing it in other things and applications that we probably use and maybe don't even realize it. If you have an Echo or an Amazon or a Google in your house that you talk to, all of these things get to know you, know your preferences, and help you make decisions about how to live your life, your lifestyle, and again, can nudge you in healthy directions or unhealthy directions. And that's something for us all to be, thinking about as well. Caring cultures. I think this is, a huge one. And I would say in all of my years of wellness, the secret sauce, this is the secret sauce, is culture. And not just culture, but it's create caring cultures. I've seen wellness programs and organizations that have every bell and whistle. They have all the incentives, they have all the apps, the trackers, the watches, whatever. But if they have a toxic culture, none of it matters, none of it works. And sometimes it can backfire because there's lack of trust. They feel like they're being tracked or poked or prodded and didn't want to participate. And so that can certainly not do, the desired outcome that you're hoping for. On the flip side, there are organizations that really have created thriving and caring cultures that in a lot of ways don't have to offer some of the expensive programs because the employees know that their employer cares about them and that they'll go out of their way to help them deal with not just how do you get healthy, but deal with life. It's a challenge now. If we've got kids that are trying to learn behind us because their school is canceled, do we have an organization that understands that and that's going to care for that? Because if they don't, the stress that comes from trying to manage all of that, about cortisol and the stress hormone, can really have some detrimental impacts on our health and well-being, lack of sleep, all of these things can be, largely impacted and quite simply can be taken care of with a culture of care. And this is a very thoughtful, a very intentional thing that has to happen from the front lines to management to the top. All layers really have to be, sort of part of this culture of care, within organizations. I'll talk more about that in a little bit, but leadership matters, obviously, and making sure that everybody feels supported and cared for in a variety of ways. And this also impacts, and I'm going to share more when we look at the employee experience. What types of benefits are we offering? What does your wellness program look like if you have one? How has it changed? And how is it really designed or positioned to take care of your team, your colleagues, your friends, your employee family in a very different way? The fourth big piece here is conscious companies. And this is kind of a big umbrella. And I would say what I mean by conscious companies. Companies right now are the most powerful entity on the planet, the most powerful entity on the planet. Organizations are more powerful than religion, government. This is a change. We have Apple right now worth $3 trillion. That's amazing. The influence that Apple, the Googles, the Amazons, these large companies have on our way of life is unbelievable. And so what we need to be thinking about, how can our companies, and conscious companies, by simple definition, are companies that are used as a force of good in the world. How can organizations that have this influence, that have this power, not only take care of their employees, but take care of their community, take care of the environment, do what they can, whether it's reducing, carbon emissions, to give back to communities, to help maybe, the lower socioeconomic groups. That we should really be depending on companies to help, really sort of turn the tide on some of the things that have happened. And that, there's a movement that was started by John Mackey. That's John Mackey, for those of you who don't know, started Whole Foods, called Conscious Capitalism. It's a not-for-profit that helps organizations really thinking about, how can they be a force of good in the world. There's B Corps that you may, have heard about in the world. Life Guides is actually a public benefit corp. So there's this emerging type of company that's coming up whose sole mission is to do good in the world. And I can tell you that, this is something that really not only, personally attracts me, but I think attracts that, younger generations, not only to buy their products, but to work for an organization that they feel like is doing some good in the world. One company that you all might be very familiar with, Patagonia, for example. Patagonia, when I was hearing one of their founders speak, he said, Patagonia is not in business to make clothes. That was never why we were founded. Patagonia is in business to preserve and protect our natural resources. And in order to do that, we have to sell clothes to fund our mission, right? That's a pretty powerful thing to think about. And it kind of flips their purpose on their head. I want to work for a company like that. I want to work for a company whose mission, whose purpose, whose goal in some capacity is to help contribute to, a better world for us, for our children, for our children's children, and all of that. And so there's a lot of movement towards conscious companies. You'll probably hear more about it. But again, it's not a zero sum. And what John would talk about when he speaks, you don't have to sacrifice anything. You don't have to sacrifice shareholder wealth or employee health or environment or any of that. That it can really be a win-win for everybody if you think about thoughtfully how to do that. So again, some big trends to keep your eye out. All of these are going to have an impact on your organization, your people, and really the attractiveness of talent to those types of organizations that are kind of thinking about these things and how to implement them as we kind of move into the future. Next slide, please. A lot of words here. And I think that, the point here is that you probably all heard, the Great Resignation. Well, is it the Great Resignation or is it the Great Renegotiation, as I like to say? Because people aren't just quitting and staying home and not working. There's a shift that's happening. And it's not just that, people don't want to work anymore as some might think, but it's actually where people are changing. I think through COVID, it really has been an opportunity for all of us to have a little bit of a reset, focus on what's important. I'm sure many of you know Etsy. Etsy, it's, now one of the top places for a lot of these, folks to go to begin their, said 4 in 10 of the new sellers started their businesses for reasons related to the pandemic. People are trying to get creative. They're trying to fuel their own passions, their own purpose. Looking at, the unemployment rate it's actually better than what it was pre-pandemic. If you think about the amount of entrepreneurs that are coming out, we're calling them solopreneurs. These are people that are starting their own business. They don't expect to hire new employees. They don't want to, but they're going to create a business entity, go out on LinkedIn, hang a shingle above their house, and begin to, whether it's coaching, consulting, creating something, cooking something, whatever it is, that there's a lot of people are really trying to tap into their purpose, their creative energy to do something else. And so I think we're seeing a lot of interesting, dynamics. And the last, kind of stat here is that The amount of people that work for an organization that has 1,000 employees or more has fallen for the first time since 2004. The people are either solopreneurs, as it's mentioned here, or working for themselves. So what's happening is people are demanding something different for their life. And if their employer can't give them that, they're finding another way to do it. And I think that's really the message here is that, organizations, if we do want to continue to grow and to create those caring cultures, it's going to demand sort of a new employee-employer contract, which we'll talk about in a second. Next slide, please. So what can we expect moving forward? And I've heard some organizations and HR folks that I work with, that's just unreasonable to have that. Whether it's things like, unlimited PTO or pet insurance or all these, kind of fringe benefits that people are offering is, we can't just give them everything. But what does it look like? And I think at the end of the day, what people really want is to feel cared for and to feel like what's happening in their life matters and that their employer is sort of has their back, so to speak. If you don't hear from your boss, for a week or two behind a computer, it creates, anxiety. And I think we're all trying to learn how do we take care of our employees in a very different way without micromanaging or doing things. But the new employee-employer contract is changing. And I think, who owns this? I think organizations do. I think organizations really, and here's the thing too, and you all know this for those that do engagement surveys or pulses or anything like that, if you ask your employees their perspective, you better listen, because if you don't, they're not going to feel heard. And the next time you ask for, their perspective, they might not give it to you. And at that point, you've probably lost an opportunity to really change, do something, or to create, a healthy organization that you're looking for. Next slide, please. So a question that, here's kind of something that I like to think about. And this, the status quo is, I think, prior to 2020, we were all humming along. Things were going, pretty well. The disruption or change happens. This would be the pandemic in our case. This could be really anything on a sort of a micro or macro level. We have three choices, right? Perpetual decline. We could just try to get back to where we were, or we could build back stronger. And so I think in all of our roles and all of our respective influences, whether it's, again, in our families, in our organizations, what is our goal? Are we trying to just get back to where we were? And I would challenge that I don't know that there's not going to be getting back to where we were, because where we were is gone now. So we need to be thinking about, how do we build back stronger? And there's a lot of interesting, ways to do this and creativity that can happen. And I know some industries have been, certainly hit harder than others. Hospitality. I was talking to the CHRO of Carnival Cruise Lines the other day. His name's Jerry Montgomery. You can imagine the cruise line has absolutely, been just decimated over the last couple of years. No one's cruising anymore for all the obvious reasons, and he's trying to figure out how to repivot his business. And his comment was, it's either feast or famine, right? For the cruise industry, it's been, incredibly difficult. Then you have businesses like Amazon, Walmart, other that have absolutely, this has been, not to mention the pharmaceutical and other industry, this has really been an opportunity for them. But doesn't mean that there's not opportunities at this point to sort of rebuild bench strength and move forward. Next slide, please. I think this is an important question for us to ask personally too. And one that I asked of myself, and I'm not one that's really into New Year's resolutions, but I'll tell you, I have two words. For me, it's healing and balance. And I recognize for myself that, and so the balance piece is really being intentional about where I spend my energy. How do I balance myself? How do I make sure that I'm, kind of getting back, healthy again, that I'm, trying to lose whatever COVID weight that I had, being more active this year, doing the things with my girls, and then healing. How do I take, my experiences, help others heal, but continue to heal myself and be part of that? And so with that, my goal is to build back stronger. And I hope all of you are at least thinking about, I love the new year, other than it being really cold where all of us are at, because it really has, it's a great opportunity for us to look back and say, okay, 2021 sucked. It sucked for me. It sucked for most of us. The bar is really low. So hopefully we can make 2022 better, because I think where we're at, obviously isn't that great. So it's okay, here we are. There's little things that we can change in life that hopefully to, put us back to a better spot. So this is something, and I'm happy to share these slides with you, because I think this is the employee journey. These are all things that employees go through. And I can tell you that, I work for a company where I was never interviewed for in person. This is the first job I've never had where I never actually met the CEO or anybody that I worked with until after I, worked there for months. It's a very different experience. It's very different than it used to be when I would put on a suit and tie. I'd walk into an office, you'd have a panel interview, there's nerves, you were preparing, now you're behind a computer. It's just that initial experience that person has is very different than it used to be. So how are you orchestrating events? Are you sending them things to their households? How are you getting them their computer? Things that you would show up at an office in a cube or a space, and you might have a welcome card there. You might have, a computer that's already there. You were ready to go. Those are all very different now. Do you send them things prior? Do you wait? How do you set expectations? What's the training look like? Do they have a buddy that's going to help them? I know in some of my other roles, I had someone that would show me around and give me tours of the building, the facilities. Now you need someone to virtually show you around. Here are the drives. Here's what we use. Here's the software, so on and so forth. So everything from the initial, accept the job application to the interviewing to the hiring is all changed dramatically in this new world of the pandemic. All of that you can see through, this is how this is, kind of organized here is everything in purple happens just once. It happens once. You have one time to get it right. And if you blow it, you don't have another chance. Not to mention you can't, or not to say that you can't, sort of repair any damaged, ground that may have happened. But these are big things. If you bring someone on and they have a terrible, first day, and I have seen this, that's going to leave, a sour taste. And so something that should be very different, the whole onboarding experience and going through these things. Some of these things happen yearly. How are you doing performance reviews now? Performance appraisals, giving feedback, something when you would sit down, maybe go out to lunch, you'd have that one-on-one with your supervisor, your boss. Through the computer, it's very different. You can't read body language as much. Sometimes they might kind of shrink back and not want to ask some of those questions, especially if you have to have more difficult conversations. I will tell you that the one thing that matters in all of this, that's more important now than ever before, and if there's one word that you take away from this presentation, it's equity. It's equity. If people feel like their experience was inequitable, and this could be anything, this could be, this is diversity in all of it. This could be, so a lot of organizations now are even struggling with hybrid workforces. On the outside, it sounds like a great idea, right? Allow people to come into the office if they want to, allow them to stay at home if they want to. Well, what's happening is that people that go into the office that have more face time with their superior, their bosses, are getting more work opportunities. So the people that actually decided to stay at home aren't having that. What about compensation? If I'm living in San Fran and I'm a programmer and I was getting $300,000 a year, but now I'm living in a bus, in Arkansas or Omaha, because I can, should I still get paid that? So we have compensation compression issues. We have equity issues. We have all sorts of different things that these different workforces have created. So I would encourage all of you to think about, is everybody's experience equitable? And how do you do what you can to ensure that it is? Because that's going to deteriorate culture. It's going to deteriorate engagement. It's going to deteriorate health faster than anything else will within an organization. So all of these things in the journey, and again, spend some time on this slide. If you want to go through each, say, okay, what are we doing with requesting time off? What are the processes, systems that we're using to do that? How are we, I think it was kind of funny in 2020 when we first, kind of went into lockdown mode, everyone was doing virtual happy hours, for team building. I haven't done one in a long time. Maybe companies are still doing them. I think we all got kind of, it's like, okay, it was cute and we did it. Now we need to do something else. Like, are we still doing virtual happy hours? But it's still important to do that. Like, how are you still going to build the team? At what point now meetings, when we're online, kind of start with, all right, what do we need to get done? There's not the coffee talk, small talk, sort of get to know each other that happens anymore. So how are you building that into the experience, throughout this journey, and so forth. So again, training's important, sick days are important, PTO, performance reviews, promotions, learning skills, retiring, non-exempt, exempt. I mean, it's a lot, but I would encourage everyone, go through each of these and talk about how are we making that experience, the journey for our employees, optimal given the virtual world that we're in today. Focused on equity. All right, that was a mouthful. So we all know this, what's going on behind the computer screen is the only thing that really matters. And unless we can help sort of not solve these problems, but support these life events, we're not going to have fully engaged, fully productive. You may have heard the term presenteeism. Presenteeism is just, you might have them show up on a computer, they're staring at the computer, but they're behind the two eyeball. There's nothing that's going on work related. They're thinking about everything else that's going on behind those doors and nothing to do with work. And in a lot of ways that can be more of a drain than helpful. You'd almost rather have those employees absent than present, but completely not there. But all of these things, and there's hundreds. I could list hundreds of tiles of things that have gone on. Whether you're, going through fertility and growing a family, whether you're dealing with natural disaster, relocation. I mean, this has been ongoing. A friend of mine called me yesterday, and it lives in Seattle. He said, "Man, there's a tsunami warning right now in Seattle." We have tsunami warnings. We have natural disasters. We just had fires in Denver. I mean, we've got tornadoes, hurricanes, and these things they feel like they're never ending right now, right? And so if your home is damaged or you're worried about a tsunami, that's going to take precedent to everything else in your family. But again, all of these things, and how is your organization supporting these in a unique way? Because this is what matters to all of us. This is what matters to people. If our kids are sick, if our parents are sick, work's on the back burner. Next slide, please. This is a slide that I've used, years in wellness. And this is, kind of my own little Maslow's hierarchy here, Ryan's little hierarchy. The idea around this is that most programs jump to the top of the pyramid, that most wellness programs are quick to, you get your biometric screening, you get your health risk assessment, and immediately, man, you gotta sleep better, you gotta move more, you gotta lose some weight, and we're gonna put you a health coach, and we're gonna solve all the things that's wrong with you right now. And that's great. And not to say that those things don't matter, but the thing is, this goes back to the previous slide. Why are those things happening? If I'm struggling with a basic need, I can tell you that my 10,000 steps don't matter. I'm not worried about losing weight at that point. I want to keep my weight. That if I don't feel safe, and that could be safety in our own homes, if that could be safety in our neighborhoods, that could be safety in the office, that wherever we're at, if we don't have that basic need met, then we're not going to worry about that. And this is very interesting as well. And again, people in the absence of information and communication make up their own dialogue and make up their own story. And so if they are working for an organization, they might not feel safe job security. They might be worried about their future with that organization, and that's all they're focused on. And that can lead to either hyperactivity, that could lead to poor work quality, that could lead to a variety of things. And everybody is very different. And so, we used to do all these kind of team, the DISC or the PI or Myers-Briggs. I mean, there's a million, kind of personality, profiles out there, but how are we using those to understand what our people need in a virtual world first? And once we know what people need, and it's different for all of us, some people can be left alone. Some people need more hand-holding. Some people need more feedback. Some people not. But these kind of psychological safety and basic needs first need to be addressed. And once they're addressed, then it's like, all right, I'm in, Wesley. Like, I feel good. I feel good about my job. I feel good about the relationship that you and I have. I feel good about the Heart Association. We're headed with an organization. Now I'm ready. To do the other stuff. I'll go, get my screening. I'll get my health coach. Well, we can challenge ourselves to 10,000 steps because I've got my foundation in order. And that matters a lot. All right, next slide. There's a lot of research here. And again, just happy to share that with you. I highlight this one because I think this one was so cool. It was at research, and it looked at caregivers. And you all know caregivers have done the highest turnovers of any job occupation. It's hard work. Taking care of, and you all know this because we all do this, taking care of others is hard work. It can be very taxing, very fulfilling, but it can be taxing. And sometimes it can be a thankless job. But this particular study looked at this caregiving facility that really created and implemented this culture of care. And what they found was not only did it improve the health and well-being of the caregivers, reduce turnover, all of that stuff that you would expect, it improved the health and well-being of the people they took care of. This stuff is contagious. Happiness is contagious. Low stress is contagious. A smile is contagious. All of these things. So is the other end. If you're stressed out, if you're not happy, all of these things. And some other research that I've showed before is, what they did is they would take stressed out mothers, they would put them with their children, and they wouldn't do anything with their children. But what they did is they measured the cortisol levels in their children just by virtue of being in the same room as someone that was stressed out. Cortisol levels are elevated. So all of these things go hand in hand. But if you think about the implications of this study from a customer's perspective, if you take care of your people will take care of your customers. And that's kind of the message here, is that the focus needs to be on your people first, not your customers first. And I think, organizations kind of have that flipped. Some do, and some understand the importance of creating this caring organization, but really taking care of their folks. Because if you do that, in the natural sort of, the natural event of things, they will automatically take care of whoever they're serving. So I think that that's the, kind of the important message there. Another study looking at, creating a culture of care. We could use all of these things in our organization. 38% in this particular study of employees are more engaged, 17% more likely to be there in a year. This is pre-pandemic, just so you all know. 28% more likely to recommend their workplace, 18% more likely to go the extra mile for the organization, 10 times less likely to be hostile. This is scary stuff. I got a call yesterday from one of our clients that had an active shooter incident at their office. These things are heartbreaking, and they're becoming the daily norm. And you can't watch the news without seeing one of these things. And I think that this is a very real and scary, thing that's happening with organizations everywhere, that when you really do have mental health issues that are going, unchecked, unaddressed for a long time, we're not creating these caring cultures, the likelihood of something, very traumatic happening goes up exponentially. And so I think that, and again, this is last night that it happened, and it's heartbreaking to see that this seems to be, and I hope it doesn't become the norm, but in a lot of ways, it does feel like we're starting to hear about these types of things more often. All right. So here's, kind of my 5 tips or advice to all of you in our lives. And the first is very simple. And this is something that, is this be human, right? And I think that was, as a former CEO, as a father, all of these things, I want to be authentic. If I'm hurting, I've called my boss and I've said, look, my bucket's full. My sister passed away in the fall and we had a lot going on at work. And I finally said, and it was just, my world was turned upside down, and I'm a single father. So I had a lot. And I called Derek and I said, look, I need a minute. So what's happening. And he was incredibly, supportive and caring through that. But all of us need to be human. If we can relate with our bosses can relate with us. If we say, I'm going to go see my kid's game tonight, I'm not going to work. If you still log in at 6 a.m. from your home and you're sending emails at 3 a.m. from your home, that's a hard, thing. And again, I work for a company. We're located actually we're everywhere, right? So we have people on the West Coast, East Coast, Canada, Mexico, India, we're everywhere. So we're getting emails all during time zones, right? So how do you set appropriate expectations and not feel like you need to be, in every time zone to be working? And so a lot of ways, and I call that, in some ways, we'll talk more about leading loudly, but being human and leading loudly. Trust. This has been, one of the most important things for organizations for years, and it's harder to do now. It's harder to build trust if you've never met someone in person. It's harder to build trust if you don't have those daily connections and those things. So you really have to be intentional about building trust with your employees, with your organization. How are you communicating? It's all changed. And so really finding ways to make sure, and again, for those of you that have done engagement surveys, trust and communication is always typically at the top of the list. More important now than ever. As people are really thinking about how to re-engineer their own life, trust is going to go a long way. Strengthen social connections. Again, it has to be more intentional now, whether it's, virtual connections, whether you're, feeling safe and vaccinated and take the appropriate precautions and meeting people in person. But it's so important that we do check in, whether you have buddies at work, just check in people, just how are they? Sometimes whether it's before a meeting, whether it's text, we always try to do either a gratitude practice with my team or just kind of say, how are you? I ask my team every day, on a scale of 1 to 10, where would you put yourself? Typically, the answer is 7 or 8. My second question is, what is it going to take you to get you 1 level up? If you're a 7, what do you need to get to an 8? If you're an 8, what do you need to get to a 9? So it's a kind of a fun conversation. I'll tell you a lot of ways that usually they get to that next level just because they enjoy, taking a few minutes to have that social connection, knowing that people care. And if you know someone's struggling, reach out. Have someone be there. And again, training management to recognize, to look for visual cues in a virtual world is really important. People generally want to feel cared for. And a lot of people aren't going to ask for help. A lot of us don't. We'll struggle in our own, kind of toxic soup for a while. And it really is hard for a lot of us to ask for help. So make sure that we are strengthening connections. A lot of that is just checking in on your friends, your colleagues, your loved ones, your neighbors, whoever, and making sure they're okay. As I mentioned earlier, it starts with us as the caregivers to the organizations that we serve. Take care of yourself. You've heard that before, not any message, more important now than ever before. It's the new year. So let's make this our best personally and professionally, and lead loudly, however that looks like. Now is the time to be brave. Be bold, change things. We're rewriting history literally every single day. We are rewriting textbooks, we're rewriting rules and policies, and there's nothing that I don't think we can't do. And so I tell you, the one thing that, we talked about in one of our calls yesterday with my team is dream. Don't stop dreaming. Like, this is really important now. Like, what would the best tomorrow look like for you personally or professionally? Or what would the best expression of your organization look like? So lead loudly, think big, be innovative. Now is the time to really dream, because we can rewrite the future together. Next slide, please. Move hearts and the metrics will follow. I think it's really important. This is what matters to people. And so let's focus on, that. Let's focus on taking care of people's hearts, physically, literally, in every possible way. That's why I've had a partnership with the Heart Association for many years. And Wes, I think I've mentioned years ago that my mother did a lot of work with the American Heart Association, peer support. And I've always loved the mission and the purpose that you guys serve. And so let's bring love, let's bring care, let's bring health, let's bring all of these things to all those that we serve. And I promise you, I've seen it. The metrics, the ROI will be there, guaranteed. Last slide. What you do today impacts more than you ever realize. The communication you have, even through computers, that little text that you might send to say, hey, thinking about you, I know we've all probably thought about doing that and didn't do it. The impact that we can have on people is far greater than I think you realize, especially when we're all feeling isolated. Those little moments matter. Those little handwritten thank you cards that we don't get anymore matter. Those little check-ins virtually, those little videos that you might send, those little thank you, those little I'm grateful for yous, whatever, have a huge ripple effect. We can be that change, and we can make someone's day much easier than we think. So again, one of the little things that we can do is what can we do today to make someone smile? And I think that smile goes to another person, another person, another person, and pretty soon you've had a pretty awesome impact, on your sphere of influence. Next slide. Something that I've been particularly passionate about is the idea of telling stories. And so for those of you that are interested, I started a kind of a podcast video series on sharing stories. We've all kind of been through the meat grinder, and I love to understand what comes out the other side, and how can people be, a true source of inspiration to others, to give us encouragement, hope. And so this is sort of one of my passion projects to really share the news and to give people inspiration in a time where I think we could use more of it. So if you're curious, there's ways you can life guides at Humanize, and that's I've got some really cool, amazing humans coming up for next Humanize. I know we're running out of time here, Wesley, so jump to the last slide here. I think that we're at. Would love to help all of you. If anything, piqued your interest today, I'm easy to find. Ryan at Life Guides. You can find me at LinkedIn. Happy to share the slides if they're not with you, work with you, answer any questions, support you, check in on you, whatever I can do to bring a smile, I'm here for. So please reach out if I can do that, or you have questions about anything I've mentioned today. But again, thank you for all of your time. I know it's tough sitting behind computers. I wish I could see all of your faces in person, and hopefully before too long. But know that I'm here to be a resource and help any way that I can. And I wish you all much love as we continue to endure the challenging times that we're in, but also that there is hope, that in all darkness comes new light. And I really believe that good times to come. So thank you, Wesley, Heart Association, and look forward to a great future.
Right. Well, thank you very much, Ryan, in helping us set the tone for part one for today's symposium. And thank you for your insights and your perspectives on how we all need to kind of reset our minds and bodies. A couple of notes that I took down is the caring culture is definitely the secret sauce for companies. And that equity piece should always be that centerpiece. And I know it's something that the AHA is definitely focusing on going forward as well. We are going, let me at least say this, we're recording the session today, and we will be sharing the slides with everybody in the post-event communication. So if you're taking notes, great, we'll be sending this information on out. So we're now going to shift gears a little bit and learn a few things from a physician standpoint in understanding the foundation of heart health. It's important to know how we started on this heart journey in order to improve heart health, and how can we start making a difference going forward. Now I would like to welcome Dr. Lena Ryberg to the screen. Dr. Ryberg is a board certified in internal medicine and a member of the American Medical Association and American College of Physicians. Prior to joining the Iowa Clinic, Dr. Ryberg practiced medicine in Tucson, Arizona. She believes communication is one of the most important aspects of medicine. She chose internal medicine because she enjoys building the close relationships that are found in primary care, and she has always had a special interest in adult medicine. So please help me welcome Dr. Lena Ryberg to the screen.
Hi, nice to meet you. And thanks for that nice introduction, Wes. I titled this presentation, The Sediment at the Bottom, because heart disease is really the last thing that develops in a whole cascade of diseases as we are looking at health over a lifetime. And so if you understand the impact of heart disease, you must understand all the things that precede these. And these are lifestyle illnesses. These are not illnesses we have no control over. There are multiple years where we have the ability to make real, sustained change. And that does bend the curve, that does make the difference, so that we don't have to have the same diseases that our grandparents, our great-grandparents had, and go through some of the experiences that they had to go through at the end of their lives. So next slide. As leaders of your wellness programs, I'm sure you have a good understanding of the data that's on this particular slide, but I would argue that probably most of your employees don't. If you looked at the headlines that were above the fold in 2020, heart disease was not above the fold. You would think that everybody and their mother was dying of COVID. And it's true. We did have a ton of loss from COVID in itself. But even in our year where this was a new emerging disease, where we had no access or very little access to vaccination for the large majority of the year, look at where those COVID-19 numbers are compared to heart disease. They are just right at half. This is data that is released by JAMA in December of every year. So we have a good amount of time to get all that death certificate data in. And so even in a year where this was terrible loss, heart disease still dwarfed COVID, or COVID was still dwarfed by heart disease in comparison. Cancer is something that certainly affects a large number of people over their life. But if you look at it, if you combine heart disease and stroke, and I would argue that we should be combining heart disease and stroke. These are the same diseases, just in different locations. That it's heart disease and stroke as a total is 1.5 times what we have from all cancers combined. So that means, yes, you got to worry about breast cancer and colon cancer and be looking at all those particular screenings, but are we considering heart disease with the degree of gravity that we should? This holds true for our subgroup analysis as well. So JAMA hasn't yet released their subgroup analysis for 2020. That'll probably come next month. But National Vital Statistics, which is out of the CDC, has released that for 2020. Both Black and white Americans had heart disease as the leading cause of death. Cancer deaths and deaths from heart disease were relatively equivalent in Asian and Pacific Islanders, but each year it goes back and forth by just a little bit, and heart disease is 1 or 2 every single year. In Hispanic Americans and in Native Americans, they had similar numbers of people die of heart disease in 2020 as had died in years past. So it's not like their heart disease got better, but it was overshadowed by COVID in that particular year. If you put everybody back together again, yeah, for all your communities, all your employees that you're serving, heart disease is something that should be on their radar as a potential risk factor for them over their lifetime. So next slide. If we look at individuals as well, men and women both have a risk for heart disease. Have you picked up any particular 1980s public service announcement You know, if you had a brochure when you're sitting in your doctor's office, if you were watching the TV, you would think that breast cancer was your leading cause of death in women, and that women did not suffer from heart disease at all. But the truth is, heart disease is the #1 killer of women in the United States. If you put all the different types of cancer combined, and that's not just breast cancer, that's all the different kinds of cancer, it claims more lives than any form of cancer combined. Go ahead, next slide. And this costs something. You know, it costs something to us emotionally as a society. It costs something to our family. It costs us in productivity, and it costs us in actual dollars. So the bill does come due for that. Direct and indirect care for CVD and stroke was $351.3 billion in 2014. That's not a number we even have a good sense of how do we process. The direct cost for CVD has more than doubled from 1996 to 2014. That's not sustainable for us. And the problem is that the curve is not necessarily changing yet. We do have projected costs from 2015 up to 2035 for cardiovascular disease. And it's going to increase slightly for age 45 to 64. You know, that cuts right into the heart of our most productive years, into our workforce, and then sharply after 65. And one thing that this data from circulation doesn't really talk about is what's our cost for all those people that have to leave the workforce because of these illnesses as well. You know, during the time where they may be taken out of the workforce for their cardiovascular disease, their cost of care skyrockets at a younger age than otherwise would be expected. Medicare does recognize this. They have these codes called HCC codes. These are hierarchical condition codes. So these codes give weight to cardiovascular disease and its equivalents. And at a combined level, that's almost more than for any other illness. And that's because these diseases pile up. You don't get just heart disease when you get heart disease. You get carotid disease in your carotid arteries, which makes you at risk for stroke. You may get narrowing in your arteries in your brain, which can put you at risk for dementia. You can get peripheral arterial disease, which can cause ulcers in your legs, and on and on and on. Each location of a plaque corresponds to a new cost, which in turn is difficult to prevent the progression and requires a separate treatment. Looking at all these things, the question is what can we do to prevent it? The bill's going to come due once we already have disease. What can we do to get our workforce to the point where they're ready to modify some of these risk factors going into it? Next slide. I really like this quote from Josh Billings. So you may not know who Josh Billings was. I didn't know until I spent some time looking for somebody who had an understanding of what we were trying to do here. Josh Billings is a contemporary of Mark Twain, and the two of them kind of seem to riff off of each other a little bit back and forth. Both were public speakers at the time and both talked a lot about health. He said, health is like money. We never have a true idea of its value until we lose it. And that is absolutely the true in heart disease. As we were talking about just a little bit ago, heart disease builds up like a sediment in a stream or minerals that are in the bend of a pipe. If we're looking at what it takes for medications to meaningfully prevent heart disease, statins take 10 years to show meaningful plaque progression. That means I need to see them not at the time of their first heart attack. I need to see them 10 years earlier. Lifestyle changes take 20 years. If you want to be able to do it without a medication or with minimal medications, I need you 20 years before that first event. The reality is I have people awake and ready to change at the time of their first heart attack. If I'm lucky, I get them because they had a company wellness program and somebody said, hey, your cholesterol's high, or hey, your blood sugar's high. And that woke them up and they came in a little bit earlier. But the sooner we can get them recognizing that these are things that can make true differences and lasting differences in their life if they pay attention to it, the sooner we can legitimately prevent disease rather than treat it after it's actually happening. Go ahead, next slide. So I find as I'm working with people in my office that why for behavioral change is key. One thing that we didn't talk about that at the beginning is I started in primary care. And, the first 4 to 5 years of my practice when I was in Tucson, Arizona, I was doing only primary care and I loved it. I had a nice small community. It was a small mining town. Everybody stayed there forever. So I was often treating 4 generations of the family. But I was seeing 4 generations of disease as it was progressing, and it was a lot of cardiovascular disease. I would be treating the grandparents and seeing the same habits that led to the disease in the parents and then the kids, and see their little kids playing on the floor in that same situation. And it was very difficult because it was almost as if you could see the future, but yet not necessarily have the tools to modify it. It was a very underserved community and had lack of grocery stores, lack of transportation, lack of exercise. All of those things really were barriers in that particular community. Decided to make a move to Iowa and came back home to where I had grown up, in part to, as I was doing that, to spend more time focusing on disease prevention rather than treating it after I was spending all this time on the diabetic foot ulcers that occurred because we've got vascular disease and uncontrolled diabetes. In the move back to Iowa, I got my board certification in obesity medicine and started treating the obesity first rather than treating all of the complications that came from it. There are 237 different complications that are associated with diabetes and or with obesity, including diabetes. And all of these things over time lead to our cardiovascular problems. I found as I was working with my patients that each individual person needs to have a strong why for their choices and why they're going to make that motivational change. And I've really liked that about the American Heart Association. We've, as an organization, have recognized that that's important. So one of the first things you do when you start working with the American Heart Association is they say, hey, what's your why? Why are you doing this? Because that's what keeps people engaged, and that's what keeps people moving forward for a longer period of time in sustained systemic change. That kind of why needs to be stronger than the kids' after school activities. It needs to be stronger than the need to pick up dinner because there's an extra project that you need to work on in the office because you didn't quite get enough done before you went home. If it's not, your health is a priority and the health of your employee is going to downgrade. And it's going to be a lower level on your scale, and you're going to do those other things first. This isn't a disease that you can decide that you're going to focus on in your 40s, 50s, and 60s. I mean, I'll take people when I can get them, and I'll meet people where they're at. But where I really need them is, that picture on the right in the center. I need that girl in her 20s and 30s to recognize that her mom had early hypertension in her 30s, morbid obesity in her 30s, diabetes in her 40s, and all of those predisposing risk factors put both those two people at risk for the cardiovascular disease that was seen in all 4 grandparents by the time they were in the 60s, 70s, and 80s. And so, yes, we can make a change. Heart disease is not necessarily inevitable for all people. It is not the inevitable end of life. But if we're going to make that change, I need the person in that picture to recognize it, not at 40 when they've had their 40, 50, or 60 when they've had their first heart attack, but genuinely when we can make a difference in disease. Next slide. The how is also very unique for each individual patient. I really like using AHA Simple 7s when I'm looking at these things with individuals. They are a focus point for people. There is so much information when you look on the internet about diet, exercise, how do you prevent heart disease, what natural supplements should you be on, should you go gluten-free, should you buy all your food at Whole Foods? You know, there are a multitude of answers to these questions, but I find things like Life Simple 7s focus people on what is evidence-based in preventing cardiac disease, because we do have some good data out there. If you look, if you start, I like to start kind of at 12 o'clock and go around. So it's having a healthy diet that's with whole types of foods that are free of unprocessed food. It's knowing what your weight is and keeping a healthy weight for height. It's getting regular exercise. And I like to use a concept with patients: limbo the things that are not good in your life. How low can you go? How little can you get of that stuff that's not good for you? And how high can you bring up those healthy habits? So if somebody is currently not exercising at all, okay, go take a walk for 10 minutes. You know, you can't take a walk for 10 minutes, take a walk for 5 minutes twice a day. You know, we can slowly build incremental change. The next one on there is to stop smoking. You know, smoking is like sandpaper in the inside of your arteries. It makes everything sticky. I don't care what else you're doing. You're going to have vascular disease if you continue smoking. So while I hate to tell anyone no for something, that's the one that is like, no, we got to figure out how to get it out of your life. The next one is to know your blood pressure and then to control it. There are so many people that know one part of it but aren't doing the other, and vice versa. And then know your cholesterol numbers and control it, and then know your blood sugars and control it. So as we look around this circle, not everyone is ready to work on these things at every minute. I can tell you, when we moved to remote work for the first time and everybody lost all their structure in their life, and they were setting up their home office and nothing was ergonomically correct, and they were working in their kitchen, that was not when I was talking to people about smoking. I mean, smoking is very important. I want to have people be able to get smoking out of their life. But the reality is when work and home were in the same location, and home was never a place where smoking was prohibited, but work was, that was a very hard habit for people to work on at that time. And it was too much of a lift. But I had plenty of patients that they were at home. And so they no longer had that 30 to 45 minute commute or 10 to 15 in Des Moines. And so they were getting back that additional time, and they were using that additional time to cook. And maybe they never really cooked in their life, but at that point they were passionate about it, and they were ready for change, and they were ready for that information. So you build on what they're ready for and where they're engaged. And that's where that how is very unique for that individual person. So you figure out, for the person who's engaged and excited about cooking and eating a healthy diet, you meet them there at that moment and get them the information that they need to take the next step forward. They'll be ready at some point in the future for smoking. But at that moment, what they're engaged about is diet. And so it's trying to meeting them right where they're at. I'm not, conversely, going to waste time of a person who hates to cook talking to them about healthy recipes. There are easier ways to skin the cat. I'm going to tell them about Fresh Fit Meals. It's down the road. There's some services over in Ankeny that do the same thing. I'm going to tell them about which meal box services are ready-made, and then we're going to leave it. We're going to put it to the side, and we're going to work on something else that they're ready for. If somebody has diabetes and they need a knee replacement because their sugars are too high to actually get it, I am not going to tell them in the middle of Omicron to go work out at the gym. They're not going to do it. They're going to be afraid of the gym itself. and they're going to, their pain levels are probably too great to embark on that kind of exercise program. But maybe at that point, because they're so engaged about their diabetes and knowing that they need that surgery, maybe they're willing to spend a little bit more time checking their blood sugars to see how different foods affect them, because that kind of knowledge is very powerful and can help them make real dietary changes. Maybe they are ready and they weren't ready in the past to start on a medication that prevents both diabetes, or the progression of diabetes, and prevents heart disease at the same time, where maybe they weren't engaged about that before. We need to meet our patients and your employees where they're at when we're deciding what to take the next step. Next slide. And then we see that they're ready for a change. And so then we meet them there. And I would challenge you as people who are leaders within your employees' wellness programs, you are there first. I am there last. And I'm not necessarily there at the moments where your employees are ready for that change. And you are a big part in helping get them to that additional information when they're ready for the change. I really liked AHA's position statement on effective worksite wellness programs. You know, we've all looked at these different programs. I know you guys are involved in them. Most companies are involved with them on a certain level because they've seen that the return on investment for every dollar spent is somewhere between $3 and $15. You know, that in an age where the health insurance costs are just going up, that is money well spent. But we are looking at effective programs too. And I liked how they quantified what portions of those programs help them be most effective. So basic healthcare education at the level and the interest of your employees, that's meeting them where they're at. Supportive physical and social environments for wellness, that's looking at buildings, that's looking at homes. What do we do to make wellness a part of our culture? It's integrating a program within the structure of the community, not just a wellness check one time a year where a nurse shows up and draws your blood. It is that screening and risk assessment. Knowing your numbers does make a difference for people, but it's also linkage to support for problems when they're identified. It's hard for me to know, because I'm at the back end of this, knowing how companies are doing on those first three things. I've actually seen the most work, you know, as I've been involved with the American Heart Association. But I do see kind of the last two things. So I do see the screening programs and I see the risk assessment, and those things are great. But I also see sometimes where that linkage is happening and sometimes where that linkage truly is not happening. I had a patient recently who came to see me after they'd been in the ER for blood pressure completely out of control, and a person who had never realized that they had high blood pressure. They'd missed multiple years of physicals, hadn't necessarily even maintained an established physician-patient relationship, and so it was a missed opportunity. They did say that they had got some lab work through their wellness program, and they'd maybe been told at their dentist's office and at their wellness check that, their blood pressure was a little high, but, you know, they just thought there was a little stressed. And so that was a missed opportunity. And what I want to do is have us catch those opportunities, because that person did not need to be in the emergency room and have the damage that went associated with untreated hypertension for a longer period of time. You know, we'll pull them back once they get to that point, but there are opportunities ahead of time where we can prevent disease rather than treating after. Would love to have an opportunity when early hypertension is there to talk to people about DASH diet and about low sodium intake, to see what we can do dietary wise, you know, if they've got sleep apnea, to treat it early so that they're not necessarily developing hypertension as a complication of untreated sleep apnea. So these are opportunities. And so looking at how that linkage occurs. Sometimes it can be as simple as giving people an electronic result for their labs. I can't even tell you how many times I've had somebody show up for their annual physical and they're like, I had those numbers checked at my wellness visit. It was about 6 months ago, and I got this little print off like receipt copy somewhere, not quite sure where it is. I think they told me my cholesterol was high, maybe my blood sugar too. I don't know. And that's kind of the sign out that I get. And then they're not sure that they want to recheck their numbers now because they did have them checked this year, but I don't know what they are. So then it makes it really hard to give them individualized healthcare information. So when companies have been able to give people an electronic copy so that they can go back to their email record and say, oh yeah, that's what it was. And then we can start having that engaged conversation at that point. That's been very helpful. So I know over the next 2 days, we're going to be having people think creatively about how to make wellness programs more effective. And I would encourage you to be involved in that. We certainly do not have to have heart disease be an inevitability for people. We can bend the curve. We can change it. We just have to get them at the right place and the right time where they are ready to make those healthy habit changes. So thanks for your time.
All right. Thank you very much, Dr. Ryberg. And to help us better understand the foundation of heart health, there is one quick question that popped in the chat before we move to the next and our final speaker here for today is that do you work with adults only or with children as well? I know that was one of the questions that popped up.
Yeah, I work with adults only. I do see, because I'm one of the few board certified obesity medicine specialists in Des Moines, there are some situations where children with adult problems who also have a problem of obesity, where sometimes it's an appropriate thing to graduate them over to adult medicine. But other than that, generally adults.
All right, perfect. Thank you. Thank you very much, Dr. Ryberg. All right, so now we are going to welcome our final speaker for today, and that is Lydia Carvajal. Lydia is a graduate from the University of Iowa with a Bachelor of Arts in Health and Sports Studies and a 2014 graduate from American University in Washington, D.C. with a Master of Science in Health Promotion Management. She is a certified health education specialist under the National Commission for Health Education Credentialing and a certified employee benefit specialist under the International Foundation of Employee Benefit Plans and the Wharton School of the University of Pennsylvania. Lydia has been in her current role as the Wellness Program Manager for Grinnell Mutual since 2016. She manages the Comprehensive Employee Well for Tomorrow initiative, impacting 850 employees. During her time at Grinnell, she has implemented strategies to enhance the existing wellness culture. For this, wellness is no longer just a program, it is the Grinnell Mutual way. I tell you what, we're looking forward to learn from you, Lydia, about establishing a great culture of health at Grinnell. So please welcome Lydia to the screen here.
All right. Well, thank you, Wes. I appreciate the introduction. And I am excited to share with you, all of you, this good information that how Grinnell Mutual has really transitioned from, this traditional wellness program to really the Grinnell Mutual way and a culture of caring, as Ryan had talked about in his presentation. So it's a great way to move forward and wrap up the day. So if we want to go ahead to the next slide, Wesley, thanks. So before we go into any of the details and nitty gritty, I do like to share a little bit about Grinnell Mutual. So Grinnell Mutual, the home office is located in Grinnell, Iowa, which is about a midway or halfway point between Iowa City, Iowa and Des Moines, Iowa, right off Interstate 80. It's over a 100-year-old company. We sell insurance, auto, home, farm, and business. We have 250 local mutuals, 1,600 local independent agencies, and roughly around 800 employees at this time. Pre-pandemic, we had majority of our employees at the home office in Grinnell, so around 500 employees. The remainder of our employee population was either then in satellite offices in Newton and West Des Moines, and then out in the field. So we've really had to pivot and make some transitions over these past few years. past 2 years with the pandemic, but I'm excited to share some of that with you going forward. Go ahead, next slide. And if you want to go ahead, Wesley, and just click, yep, perfect. Thank you. So, we have always had, for I guess the last 15 years, a traditional wellness program. And when I say traditional, I mean an incentive tied to your health insurance premium. It's a great way to start, and it has done well for us. So currently we have incentives that are tied around obtaining 2 health goals, obtaining your online wellness assessment, and then having a biometric or blood screening done. Our health goals range in a variety of different areas of wellness. So as you can see, these pictures kind of are trying to tell you what areas of wellness we focus on. But the upper left-hand corner, we have physical well-being, which, a lot of wellness programs start with that. So we have physical well-being. This includes different challenges throughout the year and different types of physical wellness that you would like to obtain. So currently right now we're doing the Live Healthy Iowa 10-week challenge, which is a lot of fun if anyone's ever participated in it. And it always gets a lot of participation. So Live Healthy Iowa, you can get an annual exam done. You can go and do a water challenge. So there's lots of different opportunities under that component. The next one we focus on is the mental and emotional well-being, which is on that with the little x-ray with the brain. In that area, we have really enhanced our focus on having opportunities for individuals to obtain health goals in that area. Obviously, with the pandemic, again, mental health has come really to the forefront, and we want to make sure that we're caring for our employees. So in this area, we challenge our employees to do the Make It Okay ambassador trainings. We have internal discussions called conversation cafes, which are surrounding different topics that people might feel stressed about throughout the year. So there's that area. Then we have financial well-being, which focuses on financial improvement. We work with principal milestones, our little educational videos that we have internally through our 401k and retirement plans that help educate employees on their finances. And then the last piece is social well-being. So this one was recently added just a couple of years ago, but at Grinnell Mutual, we believe giving back to the community also incorporates and helps your overall well-being. So individuals can obtain health goals through volunteer time. We offer 8 hours of paid volunteer time at Grinnell Mutual. They can also receive a health goal by participating in community organizations. So if they're on a city council or they're helping out at a coalition within the community, different ways like that, they can obtain a health goal. So we have had this structure for quite some time. And like I said, it is a great place to start. But if you want to go ahead to the next slide, Wesley. But we are really trying to move from out of just that base program to create a culture that's caring. And I believe in the last 5 years, 6 years, we have really moved in this direction to enhance where our culture is at. And I would say that these 5 areas these 5 actions are areas that anyone can take back within their organization to really help enhance what their current culture looks like. So this is what I'm going to talk to you about today. These 5 areas I'll go over with you right now, but also go over some examples on how Grinnell Mutual has really grown in their culture based on these action items. So the first one we have is connecting. I mean, come on, we've got to make sure our employees feel connected. As Ryan had mentioned again in his presentation, that personal interaction with another human being we're humans. We need that. So connecting your employees, communicating to your employees. Transparency is key. A lot of organizations will say that they're transparent with their employees, but truly, are they? And so it is important to be transparent, be open, let your employees know what's going on within the organization, whether it be good or bad. They need to feel valued and be a part of that company that they're a part of. And so communicating efficiently and effectively is important. Engaging your employees, another huge one. In order for an employee to feel valued and cared about, you need to engage them. So whether that be in their job or in other outside for our case too, internal organizations or groups or committees that we might have to help our employee culture, engage them in that. Empowerment is also another really big one. Make sure your employees feel empowered to move forward and be a part of these organizations or things that are of interest to them. And last, but definitely not least, support. Support your employees to grow in their careers, support them on any other endeavors that they decide to move forward on, because it's only going to enhance that culture and show that you truly care about your employees. Next slide. So here's the first two, connect and communicate. Again, with the pandemic, these have been two really important action items that need to be taking place within organizations. We're all working virtually for the most part, and so it's key to making sure your employees want to stay with your organization and again feel valued within the organization. So here are a few things that Grinnell Mutual has done. Some of them previous to the pandemic, but some are new because of the pandemic. One being our weekly town halls. So pre-pandemic, we used to have quarterly town halls where our CEO and other departments would update us on the activities that were going on within the organization. Our CEO, Jeff Maneri, now weekly updates all employees on a weekly basis. So again, whether this be good information or bad information, the one thing, like a recent happening was the COVID-19, the ETS, the Emergency Temporary Standard. So that was a scary thing for our organization. It's now at a stay, so we have some more time to prepare, but that's a scary thing to have to talk to your employees about. And Jeff was open to answer any questions. He wanted to be as transparent as possible to let his employees know what's going on, so they're completely aware of their future happenings. Also, during our weekly town halls, though, we'll have different departments come and talk about what they're doing. So recently we had all of our VPs talk about their action plans within their departments. But it's also a great time for me as the wellness program manager to announce events that are upcoming. So different wellness activities that we might have within the organization, or awards that are being given out for our employees. So it's a great way to communicate and connect our employees. One other thing I do want to mention, it's nice because Jeff, he is just an open book. I mean, you'll have employees, he opens it up at the end for a question and answer session, and he'll answer anything. I mean, you'll have employees say, "Hey, Jeff, I saw you out in your yard gardening. How are your tomatoes coming along?" And he'll answer that kind of stuff. So it's really cool because it goes beyond just that connection of business. We have got to do business, but it gives that personal touch. So he does a really great job at that. Another way to connect, we have our wellness activities, as I had mentioned, lots of different things that are either group-based or individual-based to help employees connect and stay together. Department get-togethers. I know, again, I keep referencing Ryan, but he brought up some really good points. Pre-pandemic, you saw people down the halls all the time, the water cooler talks, say, "Hey, how are you?" Well, you don't have that any longer. So right when the pandemic started, we had our happy hours or our little get-togethers. We actually are still continuing that. We have like coffee talks where people get together for 30 minutes a week or every other week and have conversations just to catch up and see how things are going. Another piece we have are our belonging committee. So we have interest in belonging groups where, just as it says, employees can get together based off of the interests they have. So we have like a Jeep club, a Jeep group. We have a true crime group, a recipe group. So lots of different groups where people can use the Microsoft Teams to chat on, "Oh, did you just see this Dateline last week? Can you believe what happened?" And it really allows people to connect and communicate on, their interests and then maybe what's coming up in the true crime world. And then last but not least, two virtual employee events. Lori Smith leads this within our organization. She does such a great job at making sure employees are connected and communicating. For instance, this was during the pandemic, but it was when COVID was a little lower. We had a fair frenzy and everybody was able to come back, see each other for the first time after a year and a half. And we had food on a stick, lots of healthy, there was some unhealthy. Food on a stick. We had our senior leaders and dunk tanks. So just a lot of fun ways to keep our employees connected. Next slide. Another key piece, engaging and empowering all leaders. So it's always important to have the C-suite, your SLT members involved and fully engaged, because without their support and their approval, nothing's going to happen. But you cannot forget about those other leaders within your organization, the ones like I have Alex, she's on the far left, Nate in the middle, and then Danny on the far right. They're all go-getters within our company. Yeah, some of them have direct reports, some of them don't, but they're leaders in other ways on getting other employees engaged within wellness and in other instances, belonging and inclusion and employee events. It's a great way to have our employees stay empowered and just excited about different things. So for instance, our wellness ambassadors within our organization are given duties. So this really empowers them to realize, hey, this is more than just a side gig. I want to fulfill these duties, and I want to make sure that I'm helping our organization do better. Another way that they're empowered as well is they have a budget. So a lot of times you're given these extra tasks, if you want to call it that, but you don't receive any money or anything extra. They have a budget to plan wellness events within their departments, to give out prizes to individuals within their departments. And it goes back to really, again, allowing employees to connect on another level. I also want to share a story about Nandini over here on the right. When you're looking at belonging and inclusion, she is such a leader. So a few years back, she took on the initiative of Diwali. She decided, you know what, I really want our employees to know a little bit more about Diwali. So she was the lead. She got a group of people together that were also interested in it. And she shared all this information on how, what the dances look like, what the food looks like, just how everything functions in Diwali, and has really taken that to the next level. But it's neat because, yeah, she has direct reports, but she's a true leader within our organization because she's engaged and she's felt empowered to be able to take this upon herself to do something fun for our organization that was outside of her daily duties. Next slide. Again, empowering is one of those key components, and a key component under empowerment is recognizing. So employees or individuals that feel recognized, it's kind of that snowball effect, because you see Joe over there and you're like, man, that's awesome. Joe won that award for going above and beyond in his wellness. Well, he did it. I can do it. So it kind of provides that trickle effect or that snowball effect when it comes to influencing employees to do better behaviors and emulate, what the Grinnell Mutual way is. So when I say Grinnell Mutual way, I know I've said that a few times, but that is one of the first awards that is on here, recognition pieces. It is an award that our CEO will give out to someone that is showing the true version of what we expect our employees to be at Grinnell Mutual. So going above and beyond, helping others, taking that extra step to really help someone out or care for them. So Jeff will announce those every week at Town Hall. If there is someone, you can nominate them through Microsoft Shoutouts, which we just added. I don't know if anyone has tried that out yet or has that application available in their Microsoft Teams. But it's a really great way to recognize employees because you can give them a shout out and tell them what they're doing great. Like they're thanking them. We have, for instance, we also have the Grinnell Mutual way. We have a wellness wow. If someone's caught in the act of doing something healthy, you can send them a wellness wow badge. So it's another great way to help recognize your employees. Another one that we do when you're looking at from a wellness standpoint is our Wellness Spot Award. So this is given out 3 times a year. And it's for employees that have really, again, gone above and beyond in their wellness journey. So nominations come in to myself. I de-identify the nominations, and then the wellness committee votes on who they feel like is most applicable or the ones that should receive it. We look at 3 different areas. We look at physical well-being, mental and emotional well-being, and then overall leadership. How are they using their well-being skills to help others and lead within our organization? So individuals that receive that, their story is told in front of our entire company at a town hall. They receive a $500 spot bonus and then a wellness day off. And they're recognized by our CEO. So the picture that you see here on the screen is pre-pandemic at one of our town halls again. So it's always really fun because we have the big check, and that they still get the big check in the mail, but they don't, it's not done in person. It's just done on our town halls. But recognizing is a huge piece of empowerment for employees, and it really allows them to grow in their values and their morals within the company. And again, the last key component of the 5 I shared is support. You really need support in order to grow your culture and have a culture that is caring. So leadership, if you have support from leadership, that is, that's key. You need leaders that are willing to help you and support any initiatives that might be going on within the organization. So I like to share this story. You see here on the side, there's a picture of Jeff Maneri, our CEO, and he was a guest speaker. I interviewed him over Mental Health Awareness Month. We had different activities throughout the month. But this was so cool because he did this in front of our entire company and shared his mental health journey. He has gone through a lot. He was diagnosed with West Nile and a very severe case and took a long time to recover. And I mean, he's still not fully recovered, but he talked about his ups and downs and challenges when it came down to his mental health during that time. And I do know, I shared with Wesley, there's a YouTube link to this interview if any of you are interested in seeing it or hearing it. But it's a great show. It's a great showcase of the support that our leadership provides for us within the company. And I hope that you can also have your leaders also do something similar. Other ways to show support are through resources. So we have a health clinic. It's recently, within the next month, going to transition to more of a mental health and emotional health clinic. So we'll have health coaching available for individuals after they receive their blood screen to go through and talk to health coaches on, action plans, goals, and, if needed, like Dr. Ryberg, send them over to their primary care provider to help them successfully get their results to be in a better place. Additionally, we'll be offering free counseling for all of our employees, on-site and virtual. So we used to have an acute care clinic, but with the pandemic, things have just kind of evolved and changed a little bit. So we're excited about being able to support our employees when they need it and where they need it through mental health resources. We have a SharePoint site that is a mental well-being corner, and it has lots and lots of resources on mental health. Again, it's been such a high priority within our organization to make sure our employees are taken care of, and it continues to be the number one priority. There's so many resources that are out there. The mental health corner allows for employees to have snippets of what they might need. So instead of doing a fire hose of information, they have one place they can go that is more tailored to their actual needs. Benefits, providing benefits that care for your employees. I mean, parental leave, affordable health insurance, all of those things show that your employer supports you with your overall well-being. Having policies that support your employees. I mean, that is so important. One policy that we have internally, and I would be happy to share with any of you, is our wellness hour policy. So we give 1 hour paid wellness time to employees per week. They can use this however they want, 15-minute, 30-minute increments. We've expanded it from just a physical component of going out for a walk or, getting a 30-minute exercise to taking a mental break. I mean, if that means that you need to go meditate for 15 minutes, if that means that you need to read a book, those are things to get you away from your computer screen and just take care of yourself for a moment. So having policies like wellness hour, volunteer time off, encouraging your employees to go out and into your community and volunteer to give back. Another policy that recently had is the work from anywhere policy. This is huge. Again, a sign of pandemic life. It allows employees that flexibility to really, if you want to work remotely, you can work remotely 100%. You can flex, come into the office a couple days a week, or you can come into the office every day of the week. It is completely your choice, but giving your employees that opportunity to have that flexible environment to take care of themselves is really valuable in our organization. The fourth piece under support, programs and campaigns. Have campaigns and, again, programs that support your employees. We had Mental Health Awareness Month in May, and we're going to continue to do it this year. But we have internal training on the Make It Okay ambassadors that is more tailored to just our employees. So making sure that you're giving people the right information to help others do better with their overall well-being or mental health. Another program that we have is the Care and Share program. And this is something that is very special to our organization. Again, we'll be happy to kind of share more information offline with you about this, but how it works is internally, we raise money for other employees that might be of need. So if an employee unexpectedly has a medical issue, they or their spouse or their dependent or their parent, if something unexpectedly happens that is a financial burden to them, a house burns down, they have an unexpected loss, and there's a slew of different things, they can submit a nomination, or not a nomination, a request to our care and share committee to go over it, and we can give them money to help them during their stressful time. It's all confidential, so no one ever knows who comes to the committee. The committee themselves don't even know. There's only a couple individuals that chair the committee that are able to have that information. That's all kept confidential. So, but it's another way to show that, we really do care for our employees. When they're in the times of need, you want to make sure that they have all the support they can have or they need. And if that is financially, we're there to help as much as we possibly can be. So those are different ways of supporting your employees. Next slide. So just a little recap on the 5 areas of actions that I think you could take back to your group of people, your employer. Are connecting, connect your employees, make sure that they feel a part of the organization, more so than just a business relationship, but a family member. Communicate, regular communication is key to feel valued within the organization. Engage employees, engage them in activities that might not be their everyday desk work, but other interests that they might have within their life. Empower them, give them that empowerment to motivate them to move forward, and support them in their initiatives that they do aspire to have. And that way it's going to really help you grow your culture to have that culture of caring. Next slide. So today in wellness, you guys, everyone wants to know then, okay, so where is this getting us? Well, today in wellness, here, we do have lots of bells and whistles. Like, again, Ryan had said, we've kind of got it all. But if you look on the next slide too, these slides I'm going to go through fast. We got the awards, we got the recognition, and these are all great. It makes me feel really proud because we have had the support within our culture and our organization to win these awards, to have all the bells and whistles. However, on the last slide here, we wouldn't have any of this if we didn't have this culture of caring. So this is where we're at today at Grinnell Mutual. And I would say that we're a family. I mean, one of the awards I'll point out is we are one of 4 companies that have won the top workplace in Iowa for the last 11 years. And yeah, that's a cool award, but we wouldn't have won that award if we didn't have a culture that cared, that, we have wellness, but we go beyond wellness. It's really a true family. We have employees that we have, let's see here, I have them written down, 142 employees out of our around 800 that have been with us for 25 or more years, and 29 that have been with us for over 40 years. So that right there goes to show, and in my eyes, a successful showing of how awesome our culture is. And it is a culture of caring because we're a family, and there's so much more to, to an organization than just wellness, all the finances day in and day out. It's about caring for your employees. And I'm happy to say that I work for an organization that does care for their employees. So this is all I have for you, but I know on the next slide, I have my contact information. I am more than happy to, spin or go back and forth with different ideas, network. It always helps when you can share each other's ideas with one another to help grow your culture to make it better. So thank you.
All right, well, Lydia, thank you very much. I can just see the passion and that you're very excited in the work that you do and really trying to engage your employees and take them to that next level. And thank you for sharing Grinnell's philosophy and the pillars and on building that healthy culture there. That really speaks volumes there. I really hope we can all apply some of those principles that you've shared at our respective organizations. Maybe we can create our own unique way, hopefully at the end of the day. So thank you very much for setting that tone for us. I really hope, as we kind of wrap things up today, we shared a lot of great information, and I hope that you can walk away with some inspiration, some tools to really make a difference for your employees' health and happiness. And I know together we can build that culture of health in all of our workplaces. So I kind of want to hear from the chat box here. What was probably one of your key takeaway from today's session, from any of our speakers. And just put that in the chat. We would love to see that. What are some of your key takeaways that you learned today in part one? I'll give a few little seconds here as I kind of close out the final comments here for today. And to that end, there are ways that you can stay engaged with the American Heart Association and achieving our mission of extending lives. You can connect with us online at www.heart.org/Des Moines. There's some great chats, great information supporting patients and caregivers, some things that we touched on today, and how can we stay healthy through and through. You can stay up to date with our local activities on all of our social media channels. You can find us on all platforms at AHA Iowa. And for additional resources on eating healthy, being physically active, and managing stress, something that we're all dealing with right now, please visit us at www.heart.org. And for our speakers contact, we'll definitely provide those details for you and the post-event communications, so you can stay engaged with them as well. But there's another important thing I want to share with everybody, and this is our virtual day of action on January 26th, where we'll be messaging our lawmakers about the important issues like extending Medicaid for pregnant women and their babies, expanding early education and Head Start, and growing healthy food access. Some of the important things that we're looking at from our advocacy team. If you're already part of The Cure, which is our grassroots network of advocates, you could have already received an invitation to join that session on January 26th. If not, you can easily join us today by texting Iowa at 46839. So thank you for joining us today for part one. I would like to thank our amazing speakers and our sponsors and our attendees for weathering the storm and adjusting the format of today's presentation. I thank our attendees for staying with us in this format with us today. A link to the presentation will be available on our social media pages early next week. And we'll also follow with our registered attendees with the recording as well, with those important materials that we shared throughout today's presentation. So that being said, this concludes part one of our virtual symposium. And we look forward to seeing you again for our finale on February 2nd at 10 o'clock. We have two additional exciting speakers who are going to be really talking about building that holistic approach around healthy companies and organizations. So you definitely do not want to miss out on that presentation to really kick off Heart Month for the association. So thank you all. Please stay safe, stay healthy here in the new year. Thank you.